Hello everyone and welcome to COVID-19 panel discussion. My name is Justin Joy. I'll be your moderator today. I'm joined by 5 panelists that serve as physicians in both United States and India. They'll be answering some common questions that they are confronted with in their respective practices by patients regarding COVID-19. As all of you are already aware, COVID-19 has and continues to take a toll on our physical and mental well-being. The purpose of this panel is to provide scientific medical information to the suffering families by discussing COVID prevention, treatment strategies, and how families can be informed and empowered during this most difficult time from a medical, psychological, and Christian perspective. This discussion is put together by a joint collaboration of Agape Partners International and Luke's International Fellowship and Enrichment Ministries. My first question is for Dr. Evelyn Vincent, who serves as a missionary doctor at Kachwa Hospital in UP. Dr. Evelyn, how is the presentation of COVID-19 infection different from other viral infections?
Thank you Justin for the question. So COVID-19, generally like other viral infections, has characteristic symptoms like fever, cough and body ache. But it differs with onset of symptoms, like it is gradual and it is noticeable. But COVID-19 has a longer incubation period as well. So the chief presenting complaints of COVID-19 is fever, dry cough and body ache with loss of taste and smell. And depending on variants, gastrointestinal symptoms like loose stools and stomach ache can also be there. And in severe cases, breathlessness and lightheadedness and coughing of blood may also be seen. In contrast, seasonal flu and common cold have gradual onset with shorter incubation of period, which means that once you are exposed to this virus, your symptoms will start showing within 4 days in case of seasonal flu or common cold, while in COVID-19 you can keep the virus for 14 days and then start showing symptoms. But it's not that COVID-19, if you're affected with COVID-19, you will have symptoms, you can be symptoms free at all as well. So COVID-19 infections in terms of severity, we have seen that 5% chance is there for COVID-19 infection to become serious or severe type. But in case of seasonal flu and common cold, only less than 1% chance is there to become serious, like it can develop into pneumonia. And for recovery, we have seen that seasonal flu and common cold, the patients recover faster, means within 1 week you will recover. But in case of COVID-19, the recovery can take from 2 weeks to 6 weeks. But due to this current pandemic situation, any symptoms which is suggestive of URI symptoms you can have. It might be a normal flu, but you need to rule out COVID because of the pandemic situation going around the world. So you have to, if you have symptoms within 1 week, you can go test yourself and go ahead with the investigation and consult your doctor.
Thank you for that answer, Dr. Evelyn. My next question is for Dr. Tony Joseph, who serves as an internist in Oklahoma. Dr. Joseph, what are the steps to prevent the spread of COVID-19 at home?
Thank you, Justin. So the steps to prevent COVID-19 can be taken in four different steps. Number one is to separate or isolate the individual. Number two is for cleaning and disinfection. Number three is washing and personal hygiene. And number four is general or universal recommendations. So if you go a little bit more deeper into that, what I mean by isolation or quarantining, we typically say that we should at least try 14 to 28 days of putting the person who may have COVID or is ill with COVID in a separate room with its own bathroom that is well ventilated. And that's a good way of at least separating that individual from the rest of the family. The next thing that you could do is cleaning. Now we use soap or detergents as well as warm water to clean surfaces, but we also ask for disinfection with at least using bleach, alcohol. But if you use bleach, you could use about 3 teaspoons in 1 liter and spray specific areas, specifically surfaces that are commonly touched, doorknobs, countertops, refrigerator handles, all those kind of things that are commonly touched. That's a good way of also disinfecting that area. Now the third thing is washing, and when I talk about washing, I mean the linens that we use, especially bed sheets, towels, handkerchiefs. Those are things that we should wash or place in a separate bucket, as well as wash with bleach if we can, or at least with warm water and detergent would be the best thing. And also personal hygiene. When we talk about that, this may sound silly, but things like when you sneeze or you cough into your elbow, don't spit in public, don't blow your nose into the middle of the air, things like that. Those are just simple things that we could do to at least prevent secretions from getting around. Now the universal or general recommendations are local and state governments have already told that, and most of us know that very well. Those are wearing a mask, washing our hands frequently, keeping at least 2 meters distance from each other, and avoiding large crowds. Now, all these recommendations you could get at your on the internet. Especially, there are some good recommendations at the health department in Kerala, and you could go to their website to get that. And again, I'm not promoting anything specific, but those are the things that I would use to try to protect our families.
Thank you, Dr. Joseph, for that answer. My next question is for Dr. Stanley Abraham, who serves as a pulmonary and critical care fellow in New York. Dr. Abraham, what are the treatment options available for people at home for COVID-19?
Thank you very much. As Dr. Joseph mentioned, the most important things are prevention, and when the time is right for you to go to the hospital, then it's recognizing the symptoms that should lead you to go to the hospital. But in terms of treating the COVID at home, the 2 most important things are understanding what can help and making sure whatever treatment that you're using doesn't hurt you. In terms of treatment options that have a benefit and no obvious harm, ginger water, green tea, and honey are fine. These things may help you feel better, and in fact, it's very important to drink plenty of water when you're having fevers or diarrhea, as you might be dehydrated. For fevers, you can also use acetaminophen, or paracetamol as it may be called in your area, and this can be taken 1,000 milligrams every 6 to 8 hours for a few days. Additionally, you can also take ibuprofen, 400 milligrams, alternating with the Tylenol every 8 hours with food for a few days. It's important not to take too many doses and not to exceed over a number of days taking both these medications, as long-term taking many of these medications over a number of days can be harmful. In all things, you should always speak to your treating physician to help you decide when you should decide to seek other medical care. In terms of vitamin C, vitamin D, and zinc, while these have not been proven to be effective, there have been reports that people who are low in these things can have worsening illness, worsening COVID. So you can take a multivitamin or just simple supplementation of vitamin C, vitamin D, and zinc. However, you should not exceed the daily limit, the daily maximum for any of these, as increasing doses of vitamin C, D, or zinc can be harmful to the body as well. In terms of treatments that can cause harm, steam treatments or AVI treatments, while steam may help you feel better and open the nasal passages, they may also cause burning of the face and the burning of the throat from the hot steam. So it's important to be wary of that. In addition, that hot steam may cause the spreading of COVID in the household, as the steam may cause the virus to spread around the house. So we would recommend staying away from that or doing it in a closed environment with the steam not being too hot. Azithromycin and hydroxychloroquine, which were initially used in the beginning of COVID, are no longer recommended, as those things have been shown to cause more harm when given with COVID over long periods of time. other medications that your doctor may be giving you when they decide to treat you that are approved in India are manufactured antibodies, plasma from patients who have recovered from COVID-19, ivermectin, which is a antifungal medication which some reports have shown that it may help, but it's still not proven whether it will help, and inhaled steroids. But in all of these things, these medications should not be used on their own. They should only be used under the care of a treating physician. And in all things, you should make sure to try to prevent illness where you can, and make sure that the treatments that you're doing are beneficial and will not cause you harm.
Thank you, Dr. Stanley Abraham. My next question is for Dr. Benson Abraham, who serves as an internist in Massachusetts. Dr. Benson Abraham, when should patients seek consultation with a doctor or go to the hospital?
Thank you, Justin, for that. When talking about when to consult a doctor and when to go to the hospital, we should look into how COVID can affect you. As we have already heard, you could be asymptomatic or symptomatic. About 40% of COVID-19 infections are asymptomatic, which means you may not have any symptoms at all. The remaining 60% are symptomatic. Among the symptomatic group, you could have symptoms with mild, severe, or critical disease. Usually, mild forms of disease could be monitored at home if necessary isolation precautions are maintained. However, severe disease or critical disease needs to be hospitalized, and those are the things that we need to monitor for. First of all, talking about mild symptoms. As we have heard, mild symptoms could be fever, cough, which is essentially dry, sore throat, headache, body aches, loss of smell, loss of taste, nausea, or vomiting. You may not experience all these symptoms, but you could experience some of these symptoms. These symptoms could essentially be monitored, and as Dr. Stanley Abraham was mentioning, you could do supportive management and care at home. The next group of people are the severe group of people. So those would account about 14% of the symptomatic group. So the severe group would have symptoms of shortness of breath. They could have low pulse oximetry reading, meaning the pulse oximetry can show less than 90% of oxygen saturations. And those are the people who might require hospitalization. Once again, any form of breathing trouble that essentially limits your activity needs to be looked for, and those have to be monitored in the hospital. The last are the critical disease, which we have encountered in about 5% of the symptomatic COVID. So those are only very minimal or very few number of patients when we think about the overall COVID infections. Those critical forms could be manifested as the breathing failure that could happen in a span of short time period, multiple organ failure, and also those requires ICU stay or critical care. And they also need mechanical ventilation or putting on a breathing tube or a breathing machine. Generally, we see that once the onset of symptom happen, it'll take roughly about 2.5 days for you to have that overwhelming breathing failure. So when you start to experience trouble breathing, that essentially limits your activity, that limits the ease of your conversation, that renders you from doing your daily activities, or if you're feeling trouble breathing when you're sitting still, those are the symptoms that you need to take seriously. And in such scenarios, you need to go to the hospital and take medical attention. Thank you.
Thank you, Dr. Benson Abraham. My next question is going to be for Dr. Evelyn again. I'm sure many of us have heard or seen patients, believe in many different kinds of myths when it comes to COVID-19. So my question to you is, what are some of the common myths that you have heard of or seen in your practice that patients believe about COVID-19 infection?
Thank you, Justin. So some of the myths that we hear commonly are that vitamins and minerals can cure COVID-19. But the fact is that if you are vitamin deficient, taking these vitamins will help in boosting your immunity, and that is going to help you to fight COVID-19. The other myths that drinking water and steam inhalation can completely kill the virus. It might help in relieving the symptoms but not kill the virus. If you can hold your breath for 10 seconds, that doesn't prove that you don't have COVID, because it only tells about the capacity of your lung. Hand dryers kill the virus on hand. Studies have not proven that, so it's better to wash your hands with soap and water regularly. Thermal scanners are to detect your temperature of the body, but not that you don't have COVID. Dexamethasone abuse. Now we hear of post-COVID mucormycosis a lot in India. So, and it is believed that it is because of the abuse of dexamethasone. So I encourage you to consult your doctor before taking steroid, because steroid can reduce your immunity, and you can have other infections like mucormycosis and other bacterial infections as well. So it's always better to consult your doctors. And extended antibiotics use also has no use in preventing or curing COVID-19. False belief in herbal medicines or a single medication to cure COVID-19. If you're eating garlic, lemon, ginger, etc. to prevent COVID-19 and regularly rinsing your nose with saline solution, if some myths are there that it prevents COVID-19, but studies still now have not suggested that. So I encourage you to consult your doctor before you believe in any of these myths.
Thank you for that answer, Dr. Evelyn. For my next question, we're going to go back to Dr. Stanley Abraham. I'm sure we know many people that are still hesitant about getting the COVID-19 vaccine. So, Dr. Abraham, my question to you is, what are some of the reasons, in your opinion, for vaccine hesitancy by people?
While some medications for treatment have not been proven to be effective to treat COVID, vaccination has been proven to be among the most effective in preventing COVID-19, stopping the spread, and making the symptoms more manageable if someone does get COVID-19. Like with all medications, we have to weigh the risks and the benefits. We've all heard of some of the limited numbers of side effects that have been linked to the vaccine, but we all know the hundreds of thousands and millions of deaths that have happened from COVID-19. The risks of COVID-19 are much higher than any risk of the vaccine, both to the person getting the vaccine as well as to our loved ones and the ones around us who are protected from us getting the vaccine as well. Going over the two vaccines that are available in India, the first is Covishield, or the Oxford, AstraZeneca, or Serum Institute of India vaccine, and the other is Covaxin, which is produced by Bharat Biotech. There's a third Sputnik vaccine, which is a Russian vaccine, but it's not currently widespread in India. In terms of the major concerns that people have when they're talking about vaccines, the number one is side effects. The chills, the fevers, the headaches that people get after getting the vaccine are actually a good thing. The vaccine presents a picture of the virus, of the COVID virus, to the body so that the body can learn to fight the virus. When the body learns to fight the virus, it creates the fever and the muscle aches and the chills as it's learning to fight it, so that when it sees the real COVID virus, it's already prepared to fight against it. So the fevers and the muscle aches are actually a good thing. They only typically last for a day or two, and they're gone within a day or two, and then people begin to feel better. So those are actually a good thing. The more serious one is the clots that have been associated with the AstraZeneca vaccine. There have only been a few hundred cases, but the AstraZeneca vaccine has been given to over hundreds of millions of people. So of the hundreds of millions of people that have safely gotten the AstraZeneca vaccine, only a few hundred people have gotten the clots. And even that is nothing compared to the amount of people that have died from COVID-19. So the risks of any clots are much, much smaller than the risks of COVID-19, both to you yourself as well as to your loved ones. The final thing is there's this myth of changing DNA that comes from the vaccine. This is only associated, this is not true at all, and it comes from the technology. People think it from the technology that's used in the US vaccines, the Moderna and the Pfizer vaccines. This is not true, but this is a different technology used in the Indian vaccines regardless. They present an inactivated virus or a weakened virus to the body. It's impossible to get COVID from these viruses. It still once again presents a picture of the virus, not the true virus, to the body, so the body learns to fight the COVID virus, so that when it sees it in real life, it's able to fight and prevent you from getting COVID. Excuse me. In the end, we all have to think about the risks and the benefits. The risks are too dire to not get the vaccine. The benefit is protecting you yourself as well as your loved ones, those around you and the rest of your country from COVID. And those are the benefits. The risks are much smaller when it comes to that. The risks of not getting the vaccine are much higher. So in the end, all of us, to protect both ourselves as well as our loved ones, should get the vaccine.
Thank you for that answer, Dr. Stanley Abraham. And thank you for debunking some of the myths that people have about the vaccinations. My last and final question is for Dr. James Samuel, who serves as an internist in Connecticut. Dr. Samuel, my question to you is, we all know that we have a calling on our lives that God has placed. How is it different for a Christian healthcare professional treating COVID-19 patients during this pandemic? How is it different for a Christian versus other healthcare professionals in caring for these patients?
Thank you, Justin. For us as Christian healthcare professionals, COVID-19 presents us with a unique opportunity to present the gospel in a compassionate manner. Rather than being driven by fear, we as Christians can find strategies to minister through our professional skills and through the gospel. We can also lament with people who are grieving, and we can provide hope to the people based on the eternal promises of our God. We can also maintain our mental health in these turbulent times through prayer, meditation through the scriptures, and staying connected with our loved ones. Matthew 28 verse 18 to 20 says, "Go ye therefore and teach all the nations, baptizing them in the name of the Father, the Son, and the Holy Spirit, teaching them to observe all things whatsoever I've commanded you. And lo, I'm with you always until the end of the world." And the gospel is the power of God for the salvation of everyone who believes. And the power of this gospel is not diminished during the pandemic. Go and tell others about the gospel. That commission stands true also during the pandemic. So rather than retreating, we should be in the forefront, helping those who are afflicted with the COVID-19, understanding that we are fulfilling the commission of our God. We as Christian healthcare professionals can pray with our patients, offer words of hope and comfort, and provide the help that they need in these times of crisis, whether it is medical or non-medical. We can provide to the people or the community the training that they need to implement sound healthcare policies, the logistics to provide better access to adequate healthcare and to raise funds to meet the gaps in providing the quality of care. We have the ability to meet people in their worst time of our need. And that is something so special about our health profession. When they are ready to open up their hearts and share their worries and fears. This is not a time to allow fear to dictate our actions. Rather, with the power and the promises of God, we go forward with helping people in crisis. Lamenting in times of loss is not something we are used to. We try to overcome our fears and our loss with distraction and false cheer. But lamenting is rather a constructive emotional response that God has given us as a reaction to a loss. We lament both individually and we can lament as a group, corporately. We grieve and pray with people who've lost their loved ones, and we can provide hope to them that is only through Christ Jesus. As we are going through this turbulent times, chaotic times, at times the circumstances may seem very troublesome. We can maintain our mental health, but it could be easy to lose the perspective. And in fact, we were never in control. Therefore, in these times, we can maintain our mental health by trusting in the power of God, who can help us in times of our need. We need to pray, and pray often, and meditate on the scriptures. Rather than reading and watching and listening to the media, and most of them are negative, we need to take some time to be in the presence of God, to thank God for his faithfulness. Philippians chapter 4 verse 8 says, whatever is true, noble, praiseworthy, think about such things. And finally, stay connected with family, your friends, and the church members that you love. Remember that you're not alone. God is with us and for us, and his promises will never fail. And may God bless you all.
Thank you, Dr. James. Thank you, Dr. James Samuel, for that wonderful answer. And thank you to all of you, our viewers, for joining us today. We hope that the answers that were provided here during this discussion by our panelists was able to bring a little bit of clarity, and was beneficial for answering some of the questions that you may have had about COVID-19. Also, thank you to all our panelists for joining us today as well. God bless you all.
In the past 15 months, COVID-19 has had a deep impact on families, well beyond the virus itself. Social isolation, infections, loss of job, and death of loved ones. At Agape Partners, we are always looking for ways we can be a blessing to families, as many are hurting from these impacts of COVID. We are so excited to invite you to the Agape Partners Annual Family Empowerment Summit scheduled for Saturday, July 3rd. Join us on July 3rd to hear from Christian leaders, professors, and counselors about faith, mental health, and family empowerment during these most difficult times. You will hear from Professor Prabhu Guptada from England, Professor Steve Stratton from Asbury Theological Seminary, Professor Anand Pillai from Leadership Matters, India, Dr. Karen Mason from Gordon Conwell Seminary, Mr. Anand Bhatnagar from Reliance India, Dr. Sam George from Wheaton College, Dr. Celine Phillip from Colorado Christian University, Dr. Leslie Varkis from Baylor Scott and White Health, and Dr. Thomas Idikla from Harvard Medical School. Last year, we had over 500 participants from 15 countries who participated in the summit. The APA Summit is a unique online summit that empowers leaders, parents, couples, and youth with relevant insights and practical skills to strengthen your family, all from a Christian perspective. There will be a total of 3 sessions with 9 brief presentations moderated by Professor Justin Joseph, Pastor Cecil Matthew, and Philson Thomas. During these sessions, you will hear about empowering your faith, family, and leadership in a time of crisis, caring and counseling during crisis, empowering mental health, and dealing with grief and loss, importance of fellowship during crisis, and hope in the midst of crisis. The praise and worship will be led by Benny Prasad and San Benny, Shinu Mariam from Delhi, Justice Stamp from New York, Washington Christian Assembly Choir Miriam, Jemima, and Ananya. On behalf of Agape Partners, we invite you to join us for the API Summit scheduled for July 3rd. To register, please visit agapepartners.org. Again, the website is agapepartners.org. Looking forward to see you all on July 3rd. God bless.